This video will demonstrate the foot AP or AP axial projection, AP oblique, and lateral. First, as we need to demonstrate the AP axial projection. The cassette that we're going to use is 24 by 30 cm or 10 by 12 inches. The orientation must be in a lengthwise position of the image receptor. No grade should be used in this procedure. In positioning, the patient must be seated or in a supine position with plantar surface of the foot flat on the IR and align the lengthwise of the portion of the IR being exposed. Extend foot by sliding foot and IR distally while keeping plantar flat on the IR. The central ray must be perpendicular to the metatarsal, which is about 10 degrees posteriorly and towards the heel, and must be centered at the base of the third metatarsal. So, base of the third metatarsal. Next one is we need in AP axial projection, we need to angulate the X-ray tube at 10 degrees. Perfect. And follow me. And center it, third metatarsal base, at the base of the third metatarsal. The reason why we need to use a 10-degree posterior angle, wherein the central ray is perpendicular to the metatarsal, is to reduce foreshortening or distortion. Moreover, the tarso-metatarsal joint spaces of the midpoint are also demonstrated better in this AP axial projection. The SID that we're going to use is 40 to 44 inches or 102 to 113 centimeter. Collimation, collimate on the four sides to the margin of the foot. I guess we already collimated it. The next procedure that we're going to demonstrate is AP oblique with medial rotation. The cassette that we're going to use is 24 by 30 cm or 10 by 12 inches. The orientation of the image receptor must be in a lengthwise. Then no grade should be used in this projection. This procedure, I mean. In positioning, the patient must be seated or in a supine position and instruct the patient to flex the knee of the affected side enough to have a plantar surface of the foot. Rest firmly on the radiographic table. Ensure that the patient's foot is placed flat on the IR and aligned lengthwise to perform of the IR being exposed. Rotate the patient's foot medially in a 30 degrees angle of the foot on the plane of the IR. We need to rotate his foot at 30 degrees angle. And note that a 30 lateral oblique projection will demonstrate the space between the first and second metatarsal and between the first and second cuneiforms. On the other hand, increasing the angle more than 30 degrees, the lateral cuneiforms will be superimposed to the other cuneiforms. Next one is the central ray must be perpendicular and centered to the base of the third metatarsal. Third metatarsal. At the third of the base of the third metatarsal. Then calling Then, in collimation, remember that to collimate on the four side margins of the flat of the foot, including the distal ankle. Note that in AP medial oblique, the third and fifth metatarsal must be free from superimposition Cuboid must be clearly demonstrated, and the base of the fifth metatarsal must be seen in profile. And collimate it at 4 sides. Perfect. Perfect. The next projection is medial-lateral projection. This projection is routinely used in most radiology department because it is comfortable position for the patient to assume. The cassette that we will going to use is 10 by 12 inches. Then the orientation of the image receptor must be in a lengthwise position, orientation. No grid should be used in this procedure. In positioning, the patient must be in a recumbent position, turn the affected side, knee flexed, and unaffected leg behind to prevent over-rotation. Place support under the affected knee and leg as needed to place the plantar surface of the foot perpendicular to the IR. Center the IR to the mid-area of the foot, and adjust it so that the long axis is parallel with the long axis of the foot. The dorsiflex of the foot must be formed at a 90-degree angle with the lower leg. 90-degree angle. That is medial rotation. Make sure that the foot is centered at the image receptor. The central ray must be perpendicular and centered to the area of the base of the third metatarsal. The area of the third of the metatarsal. The next is, the SID that we will going to use is 40 to 44 inches or 102 to 113 centimeter. The collimation, remember that you must collimate on the 4 side margins of the foot and ensure to include the distal ankle. And that would be all.